My Lords, having in part because I listened to the lecture with which we started this session, but more because it is an old anecdote, I shall forbear from telling my hospital food horror story.
Oh, good.
But I will pick up on the points made by the noble Lord Hunt and the noble Baroness Lady Barker about hospital food and how hard people are trying to improve this situation. And this interrelates with a question that noble Lord the Minister gave to me on oral questions on Monday, that of course it's dependent on the budget that caterers have and the quality of foods that are available to them. And I'm pleased that the Minister then said the government was looking to tackle government procurement, improving the quality of vegetables and fruit. And so I think that, in terms of joining up the dots, is a useful point to make. In terms of Amendment 243, I just briefly want to offer the Green Group's support and note that, having only been in your Lordship's House a little more than 2 years, I have debated a very similar amendment at least once before. I think it must have been in the Medicines and Medical Devices Bill. And this is something I think we've all seen, briefings that are very much a cry from the heart from the nursing profession to get this, and surely we can get this in this bill. But I mostly want to address Amendment 266 and Amendment 293 in the name of the noble Lord Lansley, to which I attach my name. And whilst I take the point made by the noble Lord Bethel about the fact that these procedures can be absolutely crucial to people's well-being and to enable them to be perhaps far more comfortable in their own skin, what I briefly wanted to do was address the situation of where these amendments are arriving at your Lordship's House this moment. And I'm going to quote a headline from the Times from 2 weeks ago. Quote, "TikTok and Instagram have fueled demand for nose jobs, butt lift and boob implants." Now, I used to be a sub-editor on the Times 20 years ago. Aside from when I read that headline thinking, what is the world coming to? More importantly, I think it's important to stress how much pressure there is on particularly young people from social media to have these kinds of procedures, both surgical and non-surgical. But I think it's also important to acknowledge that it's not just young people. We live in an extremely ageist society. And we know that many older people, despite our shortage of labour in many areas, can find it very difficult to find jobs, or at least jobs that are fit with their qualifications. And I note, now this is a US study, but the US Aesthetic Surgery Journal, a survey there found that 30% of people sought surgery after they'd suffered from discrimination. And I do note that the Ministry of Justice figures, in 2020, there were 3,668 complaints about age discrimination to the Employment Tribunal, and that was up from 2,112 in 2019. So the reasons why I'm saying these things is that I'm well aware that what we are very likely to hear from the Minister is, well, yes, these may be heading in the right direction, but we need more time. These are issues we have to think about before we do anything. It really is crucial, I believe, my Lords, to get action both on surgical and non-surgical issues addressed in these amendments now. And I will just finally, because no one's mentioned it, and this particularly relates to 266, there was a report out from the APPG on beauty, aesthetics and wellbeing last July, which really addressed this absence of regulation, and also, picking up on the point from the noble Lady Baroness Finlay, called for mandatory psychological screenings to be implemented. So my point is really, I'd love to think we can hear the Minister say, yes, go ahead. If we don't hear that, there really is urgency here demanding action.